want to hold a real community meeting where people come out, give their ideas, react to the recommendations that have been made, support us in our action to protect the healthcare services.
Peterborough Regional Health Centre has started to create their hospital improvement plan. They're increasing the number of staff cuts from what the original peer review had identified, up to 171 FTEs, which will probably be 200 to 300 staff, mostly nursing, that our Peterborough Regional Health Centre will lose.
We're here, of course, because of what has been portrayed as a crisis in our hospital. The peer review, of course, and its impact, the $28 million plus deficit, and its impact on what really we care about is the quality care.
Even with the reduction in bed cuts, we don't know if the staff will be there to operate them, so they may be empty beds.
Across the province, the funding for hospitals for the last 3 years has run at less than the rate of inflation. So 3 years ago, the provincial government started to dramatically curtail hospital funding. And so the funding gap between inflation and hospital funding has grown every year for the last 3 years.
This is a fairy tale report. This report pretends that we can cut 171 staff and that we can cut these beds and that the care in this community will be better.
There was very rarely a time when the ICU beds were not full, those that were open. And there were many times that there wasn't a medical bed to transfer the patients to. So I can't see that cutting 32 medical beds is going to be of any assistance.
What's going on is that consultants are hired to develop a spurious performance measurement scheme that bears no connection to quality in a real-world sense. And that performance measurement scheme is used to justify cost-cutting measures.
They're relying on health and safety and our numbers going down or maintaining. I don't know how they can do that when they just obliterated our occupational health and safety department.
I have 4 young nieces that have recently graduated and working in the hospital. They're afraid if they go on to part-time, they'll all have the trip back to Calgary. Because truthfully, they can but pay their student loans and part-time work.
I would like to retire someday, but I would like to have young nurses who have some experience at our hospital looking after our patients.
Have contributed millions of dollars, and many people in this room, including myself, have been a fairly regular contributor to the hospital because we support our public health care system.